La Sabana, a community 30 miles outside the city of El Ceibo, was chosen after a Peace Corps worker sent requests for aid. Poverty has persisted in many communities throughout Dominican Republic, with problems including poor sanitation and health care. La Sabana is one such community. As an international health service collaborative, our goal has been to provide means for a sustainable health in small, underserved communities through projects such as building latrines, chicken coops, community education, and health care.
You know, I have never felt so special. It was amazing that we get off the bus, they have no idea who we are, and they ran to us. Kisses everywhere. They're so happy that we could be here, and it's just amazing. I wish I had a welcome like that every day of my life.
We just arrived at the beautiful campo where we got an awesome welcoming. They sang for us and they hugged us and kissed us and did all kind of great stuff. And we're going to be starting our tour of the community, and hopefully this week is going to be as great as it was this morning.
Upon touring La Sabana, it was apparent that aid was needed. Very few latrines were available, and those that were present were in severe need of repair. This lack of proper sanitation results in facilities being used at ground level, which can easily run off and contaminate the drinking water with human waste. As a result, leaving the community vulnerable to endemic bacterial and parasitic infections. The solution to such a problem was to build proper latrines for the community. With the help of the community and the Peace Corps, we completed 2 latrines and started 7 new ones within a week. The process began with digging a pit 8 to 10 feet in depth and then sealing the pit with cement to prevent the contamination of the nearby water table. Next, the floor of the latrine was designed using rhubarb and cement. Additionally, rhubarb was cut and placed at each corner of the floor to facilitate the addition of walls. A large plumbing access was left within the cement floor to later connect with the latrine pit. The floor was then left to dry, as seen here. Once dry, the cement covering was placed on the pit and secured onto the pit. And finally, the housing was constructed with a ventilation system 10 feet up in the air, along with an external light source to limit the exposure of flies with the human waste.
This is our final latrine. It just holds a second. And we're gonna hammer in the last nail. That's been 1 week of hard labor, so we're really excited because we finished the latrine. Yay! Dame un besito.
This is one of our chicken coops here. We're at Flora's house. As you can hear, there's lots of music. This is one of the best places to work. We did this chicken coop. The first thing that we did basically was we dug 4 holes in the ground, measured out the spaces, dug 4 holes, put some posts in, and then nailed them into the ground, put some other wood on it, and then nailed the chicken wire to it. After that, we basically just put a roof on out of this vinyl stuff, fashioned a door out of, I think we just used chicken wire over there and some nails. And that was pretty much it. And what this ends up doing is it gives them a sustainable source of protein for everybody that lives in this house, because you don't have the chickens wandering all over the place, you don't have the eggs getting eaten by dogs and stuff like that.
In addition to building latrines and chicken coops, one day of the trip is dedicated to distributing anti-parasitic medications. Parasitic infections are far more prevalent in the Dominican Republic and result in children being malnourished. Some parasitic infections can even cause diarrhea and severe dehydration, which is one of the leading causes of death in children under 5 years of age. Additionally, providing health education is also an essential component of sustainable health care. On this trip, we performed educational skits for the children to emphasize the importance of adequate rehydration because of the prevalence of dehydration due to diarrhea in the Dominican Republic. Hand hygiene and its role in communicable diseases was also discussed. Most importantly, dental hygiene was stressed, due to the complete lack of dental care available in rural communities here. In La Sabana, buying a toothbrush can sometimes be a financial burden, especially with the larger families. We distributed toothbrushes to the families in the community, along with guidance for proper dental care.
It's Thursday morning. We are on our first day of clinic, our day of clinic. Pretty much this morning what we did is we have a bunch of people that came out. We actually had a bus that showed up this morning with people from different communities that came to see us here at this clinic. And you can see there's quite a lot of people behind me. There's a lot of people here.
So this morning we're giving them some numbers, going through triage. We have medical nursing students asking them questions and just getting kind of a basic history, and then they're going to one of 3 doctors that we have here. Dr. Casañas, Mrs. Casañas, who is an infectious disease physician at Tampa General and the health department. We also have Mr. Casañas, who is an internist.
We also have the local physician with us, and she's picking patients that she has specific difficulties with to ask us our opinion, if there's anything we would do different in their management, or what we would recommend with the resources she has, or what we can bring to them in the future. So this is not just seeing patients, but also consulting with the local physician to see what kind of help she may need in the future.
So today we're doing sunglasses also, and we're doing reading glasses. We have the sunglasses for the people when they're working out in the sun to protect their eyes. It'll help them from getting pterygiums as well as many other eye diseases. We also have reading glasses. Many of the people are illiterate, so we have pictures instead of letters, and we're using those. Even though they can't read, they still need glasses for doing close-up work, whether it's knitting or sewing, or even some cooking needs to be detailed work.
After a week of hard work, education, and cultural immersion, the trip was a roaring success, as many lasting and memorable relationships were formed. The community was finally left with sustainable tools for implementing new initiatives, which we hope in the near future will aid the community's health.
Mama merengue la